their deaths raising suspicion in the small town of Hyde. This strategy enabled him to carry out his crimes unnoticed. His facade as a compassionate doctor made him well-liked within the community, earning the trust of many patients who granted him access to their homes and personal lives. This deep trust contributed to his deceptive practices. Dr. Shipman's cunning approach encompassed gathering detailed information about his patients' wealth and family backgrounds. This intelligence allowed him to select his victims with alarming precision. The early stages of Dr. Shipman's career reveal his evolution from a small-town practitioner to a notable figure in medicine, a journey that ultimately culminated in his downfall. Understanding this context is vital to comprehend his subsequent actions. Dr. Shipman's dependency on painkillers significantly influenced his unethical prescribing habits, underscoring the perilous implications of substance abuse among healthcare professionals. This issue emphasizes the necessity of monitoring physician behavior. The eventual detection of Dr. Shipman's malpractice by Dr. Linda Reynolds marked a pivotal moment. Her vigilance showcased the critical importance of oversight within the medical community to avert future tragedies, setting off a vital investigation. The uncommon choice to cremate patients rather than bury them aroused further suspicion, as most local customs lean toward traditional burials. This divergence from standard practices raised red flags regarding the operations of the clinic. Dr. Shipman's patient base primarily comprised elderly women, amplifying concerns about their care and the doctor's potential involvement in their deaths. This demographic profile added layers of complexity to the ongoing investigation. The significance of Form B and Form C in documenting patient deaths illuminated a potential weakness in the legal framework governing medical certifications. Shipman exploited this loophole, facilitating unchallenged cremations. Initially, Dr. Shipman's closeness to Kathleen's family obscured potential motives, complicating the investigation. His position as the last person to see her alive further intensified suspicions surrounding his actions. Angela Woodruff's discovery of inconsistencies in her mother's will prompted a renewed investigation. Her revelations regarding the missing house cast significant doubt on Dr. Shipman's credibility. The autopsy uncovered traces of heroin in Kathleen's body, directly contradicting Dr. Shipman's explanations. His subsequent attempts to obscure the suspicious circumstances only escalated the police inquiry. The investigation unveiled a troubling pattern of lethal doses of diamorphine administered to patients, with Shipman himself signing their death certificates. This situation raised profound concerns about medical ethics and oversight. Families of the deceased patients were interviewed, and forensic postmortems were conducted to unravel the truth behind the suspicious deaths. This meticulous process highlighted systemic failures in supervising healthcare professionals. Speculation regarding Shipman's motives encompasses a range of psychological factors, potential financial gain, and the impact of his mother's cancer treatment. Experts have mulled over the complexities of his actions, though definitive conclusions remain elusive.